All right, I think we can go ahead and get started. Hi everyone, my name is Mike Vasquez and I am the Digital Sales Account Coordinator at VisualDx. So I'm part of the e-commerce sales team and I'm joined today by Dr. Azeen Sadeghian. And I'm just going to give you a brief overview of VisualDx. If you have any questions during the demo, please feel free to use the Q&A feature in Zoom to ask that question. I'll try to check during the presentation and answer them if I can. If not, you can always email me directly at mvasquez@visualdx.com, or I can follow up with you via email as well, just based on your attendee info. So I'm going to go ahead and just get out of PowerPoint here and hop right over to the web version of VisualDx. So just go ahead and maximize this. So for those who are unfamiliar, VisualDx is a clinical decision support tool that's designed to be used at the point of care. So I'm going to start off by demoing the web version of VisualDx, but it's important to note that everything that I show on the web on my desktop computer, we can also do on our mobile apps for iOS and Android. So when you log into VisualDx on the web, which is what I've done with my work account here, you get taken to this homepage. So you have some informational links on this sidebar, but the main interface is right here. So you get this universal search bar. It's very similar to a search engine like Google. You can either go straight to a diagnosis. There's over 3,000 in the app. It covers all of general medicine. Or you can build a differential based off of a chief complaint, medication, or travel location. So just to start off and demo, I'm just going to go to an example diagnosis page that I know has a lot of great images, and that's shingles. So when you search for a diagnosis page, they're all structured the same way. And again, the way that VisualDx is structured and presented, it really is designed to get you to the information that you're looking for as quickly as possible. So I'll show the mobile app on my iPhone after we're done with the web portion. And you can see here that at the top, we give you the diagnosis. You can change, to be adult or child. And we break it down based on these sections. So compared to a reference tool like a textbook, if you're on the web or you're on your mobile device, you can quickly drill down to any of these sections by clicking on them in the sidebar or by scrolling through. So we'll give you a brief synopsis, top-level codes, things to look for, diagnostic pearls. I won't read all of them off, but you can see here that you can drill down to any of these sections.
So I'd also like to add, this is a really quick and useful resource on the fly during your clinical care. So you don't have time to really reference a textbook when you're in the middle of your clinic or when you're rounding. And so you're able to access this very quickly. Another thing that I appreciate about this is how it links out to your differential, meaning that if you are considering different things, you can just tap on one of the differential diagnosis pitfalls and compare these things kind of rapidly on the fly, side by side. I also, oftentimes when you're looking up something, you just really want to know what labs do you need to order or what treatments do you need to order. And so that's all here, and you can access it within seconds and then just kind of carry on with your clinical routine. Another aspect that I really appreciate about this page is the drug reaction data. In the era of polypharmacy, we know our patients are on multiple treatments. And a lot of times there are concerns, are certain treatments predisposing our patients to certain illnesses or diseases, and a lot of times they are. So for example, certain medications can increase your patient's risk of developing zoster. In these cases, typically your immunosuppressants. And so if you're wondering, like, does my patient's on Humira, is that, why they've gotten shingles? They just started their Humira, a few months ago. Well, you see adalimumab right there. There's 4 citations of it being associated with that. So, your anti-metabolites like your methotrexate, things like that are pretty high on the list. So the number of citations, there are librarians who are on staff at VisualDx, and they are able to formulate this list. And whenever you click on the hyperlink, you're able to link out to certain things that are associated with that medication and that disease, like case reports and things of that nature. So that's very helpful. And then for educational purposes, the references listed in the table of contents will pull you towards evidence-based sources where you can reference. You have a PubMed ID that can quickly branch you out. If you're at a hospital setting or school setting, oftentimes you have a library access, and so you can quickly access these articles on the fly as well, which is really helpful.
Thank you, Azeen. Yeah. So when I demo for people, one of the main questions I receive is, how often is the content in VisualDx updated? And so not only do we cite the sources here in the references section, but if you scroll all the way down, you can see not only when was the page last updated, but when it was last reviewed. So we have a full editorial team on staff of medical librarians, copy editors, and physician contributors who ensure that not only is this information accurate, but it's up to date. And you can see here at the top of each diagnosis page, we do list the contributors to this page. Another great part of these diagnosis pages is that for our most popular ones, we have these patient handouts. So they're a really nice tool for patient engagement. They're available in English and Spanish, and they're 1 to 2 pages long. I believe they're written to be understood at around a 5th grade reading level. And it just includes some basic information about the diagnosis, such as an overview, signs and symptoms, self-care guidelines, treatments that might be prescribed. What's really nice about this is you can either print it up, and you can include one of our images, which I'll, show you next, or you can actually email it and it'll come from our server. So it'll come from visualdx.com and not from your personal or provider email. And then when it comes to our image collection, this is something we're really proud of. So VisualDx has been around for over 20 years, and we've been curating this really robust image collection of over 40,000 images and counting. So just like we have an editorial team on staff, we also have an imaging team who collects and curates these high quality scans from various learning institutions and private collections around the globe. So I can go here to any diagnosis, and our goal here is really to represent the full spectrum of disease across skin types, body location, morphologic variation, and other diagnostic features. So you can see here, not only do we have over 150 images for this diagnosis alone, but our team has also been adding captions recently. I can click on any images in the collection, it'll enlarge, and it's a high quality image. I can see this in really great detail. I can get context for the image. I can see the classic variations as well as, different, less common variations. And what's really cool here is we also have this filtering capability. So all I have to do is just click on filter, and there's a couple different things we can do here. So one is if you're using VisualDx, on your desktop monitor in the office with a patient, you can go ahead and hide severe images or hide genital images. You can also filter based on skin pigmentations. You can filter by lighter or darker Fitzpatrick skin types. And we're really committed to diversity in medicine here. So over a quarter of our images are skin types 4, 5, and 6. So, compared again to like a textbook or an older type of resource, I can drill down to this information very quickly and see how it would present in someone with darker skin. And again, I can click on any of these images, and it's that same high level of quality across the board. So, unlike doing a Google image search or something else where you're going to get different resolutions and you don't really know what you're getting, nothing's been vetted. Everything here has been vetted for quality by our imaging team. Same thing for body location. I can go ahead, I just reset the filters there very easily, and I can filter based on body location. So if I want to confirm a diagnosis visually with a patient, I can do that. Or even for myself, if I'm, 99% sure it's a certain diagnosis, but I want to find, a presentation that's similar to the one that I'm seeing, I can go ahead and do that in the app. And you can see that once you're familiar with that interface, you can do that in just a matter of seconds.
So I'd like to add, I love this feature. I think it's very helpful to establish trust with patients when you can show them an image that is similar to what they have. A word of caution about Google searching images is that a lot of times Google will pull up images that are unrelated to what you're searching. It just happens to be related to the search term that you're searching on a different page. And so as a dermatologist, I will tell you, if you Google search something, you will find various images that are completely unrelated to what you're searching. So just medical caution on that.
And it's also important to note here too, just as a reminder, that I can do all of this on the mobile app as well. So we have a lot of users who primarily use VisualDx on their phone. I'll show that mobile app soon and show how you can filter in there as well. So I'm just going to go back to the homepage now of VisualDx and go back to that universal search bar and that quick start differential builder button. So the other way to use VisualDx, if you're unsure of a diagnosis, is to build a differential. And there are a few different ways to do this in the app. So I'm just going to go through all of them, each of them quickly. The first is by using that search bar. So I can type in a chief complaint, medication, or travel location and use that to start a workup. So I'm just going to do a couple just to show you how that interface looks. So one is, let's say a patient comes in and I'm going to build a differential diagnosis based off of itching. So if I click on that, you can see here what we do is we take you to a guided workup. So our physician contributors here have suggested findings that they believe you should enter to narrow the results of the differential. And the more of these findings that you enter, the more that this differential strength meter is going to go up. The higher that bar is, that means the more narrow the results are. So I can go ahead here in the sidebar, I can adjust patient information, maybe it's a female in her 20s, and I can walk through this if maybe I'm unfamiliar with derm or this particular specialty, and I can just run through and enter as many or as few of these as you want. So I can go in and click through, and I can be, as specific as I want and say maybe they have a hyperpigmented patch, the location. I can go ahead and I can either use this visual workup or I could actually type it in here in this additional findings bar. So I can say, it's on the posterior neck, and already we have a strong differential. So I can either walk through more of these and enter them, or I can click through to view the differential results. So I'll click through just to show you the interface of what those results look like. And then I'll go back and show you a different kind of chief complaint just to show how this workup changes based on specialty.
So I'd like to add, this is a really neat feature because it's not often that in a medical resource that you can search through your symptoms and through the diagnosis if you know the diagnosis. I'd like to use the differential builder because a lot of times you are stuck with a tough case and you have a very small differential, and you really, for the safety of the patient, need to see how broad you can get your differential so you're not erroneously closing your diagnosis too early and basically pivoting to something without considering all of your potential differential.
So if I click through and view the differential results, we'll see here that by default for a derm workup, we default to this card view. So you can visually compare between different results very quickly, because again, we're really trying to get you to the information that you want as quickly as possible. So we break the results down into these different tabs, results that we think you should consider first, second, infectious diseases, drug-induced conditions, and of course you can view all. So I can go ahead here, I can click on any of these findings, and I'm taken to this little card view where I can cycle through some images, get a very, very quick workup, and then I can click through to see the full article, which is one of those 3,000 plus diagnosis pages. You can see here, just like the page for shingles, the structure is exactly the same. All the information is laid out the same way. We have images in the sidebar, the patient handout, and the link out to other resources. But if I go back to that results view, you can see here, I can actually go here to the right. I can go between the default view, which in this case would be that photo view, but I can also switch to a list view, which is more familiar. That's the classic kind of Google results view where it's just a list of all the results. But I can see how many findings that a result matched, how many images are there for diagnosis. And again, if I click on that finding, then I am taken to that brief card view, which I can X out of. So to go back to my, sorry.
Oh, no, I was going to add, I think this is really helpful because a lot of times, you as a physician are to know a lot of these diagnoses, or a provider, you should know all these diagnoses. But the problem is it's hard to recall all of them whenever you're distracted in clinic. You have your MAs asking you a bunch of questions. You've got like 3 patients in the exam room. You're getting calls. You're getting pages. This is helping you, okay, rapid fire. I need to look at all these. I'm not going to spend my time clicking on every single thing, but I can already, just by looking at this, rule out probably like 50% of these, right? Just because I saw the patient and I'm like, okay, it's not scabies, it's not melanoma, it's not prurigo, things like that. And if you do a differential diagnosis, there is an additional tab for some of your differentials to like an emergency thing, like things that you should consider, if you miss it, you are missing an emergency. And so that's really helpful because it serves as a safety net and security. As you know, the buck stops with you. And so you really need to make sure you have a safety net so you are not missing an emergency and putting your patient at harm.
So if I go back, I'll show you the second way that we can build a differential. So the first way we did it was by just typing in a chief complaint here in that universal search bar. The second way is by using this quick start differential builder button. Now what that does, if I click on this, it actually just lists out our most popular chief complaint types by specialty. So what I had before was I had itch and I was taken to this derm workup where we try to visualize the different findings that you could enter to build a differential. But if I go back, click on that button, and let's go with something that's not derm. Let's just go with something like fever. You can see here that the findings are actually different. So we suggest different findings because it's a different type of workup. So I can run through this and I can, enter the onset of findings. Again, I can adjust my patient information. Maybe they're in their 30s, their appearance, etc., and just run through as many or as few of these as I want, just to build that workup. And again, I can always type in additional findings. If they have a cough or something like that, I can go ahead and enter that. So in this case, I'm not sure what we're going to find, but it looks like we have an excellent strength differential. I'll go ahead and click those results, and you can see here, just like what Azeen was saying here, we do have a tab for emergency diagnoses. So we color code these in the results, so it's very easy to see. And these are life-threatening conditions that would require immediate medical care. And you can see here that we do really try to boost those in the results. You can see those very easily. I can click through. And again, you can see that we have more than just skin images here. We have scans and lab images as well. And then what I'm going to go ahead and do is switch over to my phone and show the last way to build a differential diagnosis in VisualDx. So just give me 1 second here.
As Mike is doing that, I want to point out, if you look at the left hand of the desktop, you could see that there was CDC and WHO information and public health information. And that's one of the values of having VisualDx is you have up-to-date information on things that are public health and or even international medical situations. And so you have a resource that's updated frequently in that. And so you can utilize it to your advantage, because a lot of us have not seen, multiple COVID cases. We may have seen only, I personally have not treated anybody with COVID, but I'm expected to be able to triage and manage somebody with COVID very quickly. And so that is a resource. It's, everyone is pulling together their information internationally in order to create that kind of resource.
All right, so what I'm going to do now is I'm going to go ahead and pull up VisualDx on my iPhone. And this is a very similar experience on Android as well. There are just a few stylistic differences. But again, everything that I showed on the web in those previous, during the previous minutes, I can also do on iOS. But what's really exciting about our mobile app is we have this add-on feature called DermExpert. You can see it in the top right of my screen there next to the search bar. So what DermExpert is it's really a different way to kickstart that differential building process. So instead of typing in a chief complaint, or a lesion type for building a derm workup, I can use DermExpert to use a picture and use that to identify the morphology of a lesion. So if I go ahead, I'll just tap on dermatology, and you can see here, because I have DermExpert enabled on my account, I can hit take skin photo. So it takes us to this camera viewfinder, so you can go ahead and you can actually see right now my laptop that I'm presenting on. I can either take a picture or I can import one from my library. So I'm going to go ahead and I'll import one from my library. So I have a few sample images here that we've received from users over the last couple of years. I'm just going to select one, and then I'm going to hit use this photo. So what DermExpert does is it uses machine learning to compare that image to our database of skin images on your device. It never is transmitted off your device. It never, leaves your phone. It all happens on the device using your phone's machine learning cores, and it goes ahead and actually tries to identify the morphology of the lesion. So I'm just going to hit use this photo, and you'll see it in 2 seconds. It's going to come back with results. So what DermExpert does is it comes back with 3 possible results for what it thinks the lesion type is, along with its confidence level, which is that bar underneath each lesion type. So what I'm going to go ahead and do is I'm going to select the one that I think it matches, raised scar. If I wanted to select a different lesion type, I could hit that button, and I could, pick one from there too with descriptions of each type. But I'll go cancel there. I'll hit raised scar. And then it's just going to funnel you through a few questions just to refine the results of that differential. So by design, it's not taking you straight to the results. It really does want you to provide more input to make sure that it's providing you the most accurate differential. So in this case, this was a male, and he was in his 20s. So again, it's very similar to that workup process on the desktop. It's just laid out a little differently. And I'll go ahead and I'll select limited area, and I can either tap on the body part itself, or I can tap on it in the sidebar here. So I'll just say neck. I could be more specific if I want, but I'll just go ahead and hit next in this case. Didn't itch. There was no fever present. And let's just say it developed acutely in this case. So when I go ahead, I'll hit patient appears well, and then it's going to take you into that derm differential. So just like on the web version of VisualDx, this is how your differential results are going to look on mobile. And you can see here that there's complete feature parity between both versions. I have the different tabs. I have different views that I can switch between, so I can go and actually, read some brief information about my results, or just see that card view where, again, I can compare differently between different results. In this case, this was the result, so I can go ahead and tap on that. And just like on the web version, I'm taken to this diagnosis page where I have over 60 high quality images for this diagnosis alone. I have the diagnosis, all that information. And if I hit that hamburger menu button in the top right, I can actually drill down to a specific section. So again, if I want to see references, I can go ahead and drill down to that very quickly. If I go back up to the top of the diagnosis page, if I hit images right here in the middle, you can see here that just like on the web version of VisualDx, I can hit that filter button. I can filter based on that skin pigment, body location, even image type. And I can also hide those severe images as well. If, say I'm using it on a tablet and I want to be able to show the patient what I'm looking at, I can go ahead and do that. And again, just like on the web, I can see that image in high quality. I can pinch and zoom and see that. So there's no degradation in quality. There's no feature loss between platforms. It really is fully featured. And we have a lot of users who primarily will only use one platform. They only use it on their work PC, or they only use it on their phone or iPad. And they're able to access all those features as well. Same with the patient handouts. You can see here that the entire thing is right there. I can switch between English and Spanish. And if I hit that share button, I can email it from visualdx.com, or I can print it up and actually give the patient a physical resource that they can refer back to later on.
Now, the beauty of this is all HIPAA compliant, as Mike was saying. And then another thing that's helpful on the fly when you're on your cell phone is sometimes you need to code on the fly as well. And what I mean by that is you need to know your ICD code. And so that's really helpful because sometimes your EMR doesn't generate the correct codes. And so this is a helpful resource as well.
Yep, and then the very last thing that I'll mention during this demo is that we do allow users to earn Cme credits while using the app. So for every diagnosis search that a user performs in the app and every differential that they build, they earn half of an AMA PRA Category 1 credit. And those are completely unlimited. So just as you use the app, you just accrue those potential credits. So if I go to my account page, for example, and I just hit Cme, you can see here that just from demoing the app at conferences over the years, I've earned over 1,000 potential Cme credits. And it's so easy to go down and drill into it either on the web or on mobile like I am now. And I can go ahead, answer a couple of questions, and then complete that half a credit. So again, as you're using the app, you're just earning those credits, which is fantastic. We have a lot of users who will use their Cme funds to buy their VisualDx subscription because they know they're going to earn credits as they're using it.
Yeah, so that's, go ahead. Yeah, that's great. The Cme aspect's really helpful. VisualDx has helped me not only in, obviously Cme is a huge help, but educationally it's a great resource for students and residents and for teaching. And you're able to use it on the fly. Clinically, how I used it was, as I was saying, to help save me time. A lot of times I used it as a rapid resource because it is integrated from various platforms. I always had it uploaded on my cell phone, and then I also had it pulled up on my my desktop. So whenever I was working on notes, I could quickly reference things. It definitely served as a security source for me as well to make sure that I wasn't limiting my differential. I know in medicine you've heard you only know what you know, meaning that if you only know 3 diagnoses, you're going to put everything under those diagnoses. If you are biased, meaning right now everyone's biased with COVID, right? COVID's on everybody's mind. So if somebody presents with cough and fever, you may prematurely close with COVID. What if it's atypical pneumonia though, or what if it is tuberculosis? Those things still occur even though COVID's occurring. And so you don't want to have premature closure because you either don't know or you're not considering broadly. And so it really helps kind of to strengthen and augment your intelligence in that way. And then lastly, I loved it for just the drug reactions and drug associations as well.
Thank you, Azeen. So looks like we're concluding now. It looks like there are no questions in the Q&A feature. I have my contact info up, so I will say if you have any questions, you can email me directly or you can contact us through our website. We have some contact forms there, and I have eyes on those as well as some other people in the company. We offer a full 30-day trial to all new individual subscribers, so you can use the app on the web, iOS, and Android and test it out for a full month. And then we also offer, discounted pricing for groups as well if there's any interest. So definitely feel free to reach out to us if you have any questions, either now or later. We're happy to answer them for you. And then that's it for me. I hope you enjoyed this demo. And again, feel free to email me if you have any questions or feedback afterwards.
Thank you all for dropping in.